Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody out there. Good to be with you.
You have been out and about traveling, learning stuff.
Yes. Well, I just flew back in. Well, I drove back in, but the wind blew me back in from the Windy City in Chicago a couple days ago. So glad to be back, and always glad to meet with other practitioners from around the world that are working on helping ourselves feel better, and through ways that are a little bit outside the box. So, yeah, the conference was through the IFM, and it was fantastic. We talked at first couple days about toxins, and then the last couple days about the gut. And so there's enough material there for me to talk forever and ever and ever. Amen, Dave.
Yeah. Well, today you're going to spend some time with us on toxins. We haven't talked a lot about, we've talked about the gut quite a bit, and we could talk a lot more about the gut, but we haven't talked a lot about toxins.
You know, it's there was a Dr. Roundtree that was there, and he mentioned, he's like, I'm not Dr. Doom, because when he started to talk to us about the sheer number of toxins out there, he's like, I don't want you to get down because there's a lot to do about it. And but yeah, to that point, Dave, there's a lot out there, and you can start just from the start of your day when you take your first breath in the morning and hop out of bed, and you are in that environment. What's floating around in that air, and what's in that first sip of water in the morning, and what is in that product that you're putting on your scalp to clean your hair, and so what I found was, and the big thing right now is microplastics. Microplastics, Dave, are everywhere, even in the air we breathe. And that's getting into our bodies. And just like the ocean, we're an ocean, 70 to 80% water. So it's not good for the ocean, not good for our bodies. And there's a lot of all this compilation out there of microplastics that gets in the brain, to heavy metals, to the different cleaning products we use, to the fluoride in the water, to the dental toothpaste we use. It can almost be a little overwhelming, but we can help take that overwhelmingness away if you come and hang out with us a little bit here at the clinic. But because we can keep it simple, and we can dig deep. So a lot of times when we're trying to just keep it simple, just little things can make a big difference in your day, in what you're eating, what you're not eating. So much of we have touched a lot on processed foods and the wanting to eat more of we've touched on gluten and dairy, which, and for some folks can be a toxin or an irritant or an allergen. But what we're trying to do is just baby steps for many out of the chute can make a big difference in feeling better fairly quickly. And then you throw in all the other things that we do. It's faster, but something as simple as looking at your plate every day and eating the rainbow, in a sense, eating as much color. And I look back to myself over the last few years and being a Midwest boy, there's a lot of meat and potatoes on that plate and not a whole heck of a lot of color. And so we want color because color has so much more vitamins and nutrients in it. And so when we're not eating that colorful plate, that's where a lot of times I'm doing my lab work and saying, ooh, we're short on that vitamin or that nutrient. And if you're not going to work towards a more colorful plate, then we need to help you out a little bit with some supplements to support the lack of color. But that is a big factor, and in identifying what is also toxins for you. We have all kinds. We've got testing. There, we didn't even touch on glyphosate yet. Glyphosate's a big one. Well, there's actually urine testing that we can do for that. So it's just coming in, doing a simple visit with us where we have intake forms to ask you questions about your exposures over the years of different things in the environment. And then sometimes we need to hone it down further with specific lab testing that's going to identify where the lowest hanging fruit is for us to maybe start with. But, two big things, Dave, that I thought were pretty doggone interesting was we all know that the liver is a big piece of the puzzle for us, and that's like the oil filter. Well, we need to change that oil filter, and that's our big detoxifier, one of our big detoxifiers. So if we're getting this barrage of toxins all the time in our body and exposures to environmental toxins, then it's an extra stress on that liver, and then that is almost like an engine that overheats over time or gums up and doesn't work efficiently. What do we need to do to fuel that liver so not only we're avoiding what is triggering us and causing us to maybe misfire and being inflamed and have brain fog and fatigue and joint pain and all the things, identifying what those environmental things are so we can avoid them, but also what is the body doing to find balance to try to get rid of these toxins. And if the liver has been irritated over the years through the SAD, the standard American diet, then the liver it's not going to do as good of a job of getting rid of things. So they give you three. We've touched on glutathione. Glutathione is part 2, a phase 2 pathway of the liver that's very important. There's a lot of different pathways in the liver. There's a phase 1 and phase 2 biotransformation that occurs. And with these two processes, we want to support phase 1 and phase 2. So glutathione is kind of like calling the fire department for the liver or the body. That is huge at reducing inflammation, free radicals, and can help us feel better faster. A few other big ones that are supplements over the counter, berberine, which comes from the berberine root. It's very helpful for the phase 1 part of liver biotransformation. And another part, phase 2, is the glutathione and B vitamins, and many times we need methylated B vitamins. So those are some 2 tidbits. Now, I always ask that you talk to a medical professional, your doctor, about these things before starting them, because those, even nutrients and supplements, can have an effect on maybe some other prescriptions that you're on and how those are processed. So it's important to talk to a medical professional or do the due diligence research on your own as you walk through this. But it's what the other thing that struck me was how they gave and we've seen it here at the clinic too, all these testimonials of a few changes just to get started. So if you're drinking your Diet Mountain Dew or your Diet Dr. Pepper every day, and you're eating boxed food and your processed food, those just changing those 2 things by themselves can make a huge difference. Eating more color on the plate can make a huge difference on how you feel, on that inflammation, the balance in your body, all those things. So it can sound like a daunting task to kind of go through and identify. I mean, I find things all the time, Dave, myself, where I'm like, things I didn't even think about, but like that shaving cream that I'm using. Like, I picked up some shaving cream last night, and I told my wife, Carrie, I'm like, I need to start using olive oil, because if the skin is another organ. Mm-hmm. And one of the things they talked about there was, if you're not, what you're putting on the skin, would you ingest it? Really makes you think twice about things, like the shampoos that you're using, that kind of stuff. Because a lot of these things can be pretty doggone hard on the body, and when we're already out of balance and already inflamed, and you add another toxin from a shaving cream, something as simple as that can make a difference, Dave. So it's a lot of times it's starting head down and think, oh, I'm hopping into the shower today, and what is it that I'm putting into my hair?
Right.
You know, should I be washing my hair every day? And if so, what should I be washing it with? So it's a journey to walk through this, and we are here at the Okoboji Wellness Clinic to help you walk through that to get feeling better and be your teammate, because it's a process. Now, you can go to the EW, the environmentalworkinggroup.org. That's a good resource. They list some products that are, quote unquote, more clean. There's another place where they talk about I think it might be on this site, the Dirty Dozen. And those are the foods that you want to try to find that are more organic. And then they list some foods that it's not maybe as important that they're organic. Of course, if we had all the money in the world and we could all eat organic, that would be really good. But, you know, it's kind of picking and choosing what's going to be the best bang for the buck for us from a whole perspective on where we want to put our resources. And, but like I said, a little bit of change can make a lot of difference.
And one thing, you're right, this is daunting because I've just kind of started to go down this road a little bit. And one of the things I've been studying is seed oils. And one of the things I've uncovered is coconut oil. And coconut oil is amazing. Not only can you cook with coconut oil, tastes terrific, and you can use it to give a massage. It's phenomenal.
It's phenomenal. You can put it in your coffee in the morning. MCT coconut oil, like you said, you can cook with it. It's huge for brain health. It's great for if you're getting more on the constipated side. It's not an inflammatory oil. Get back to your whole point on the seed oil. So it's not that's one it's clean, and of course you want to find the one that is clean. Mm-hmm. In like a jar, it'd be best if it's in a glass bottle, but if it's in a plastic bottle, that is BPA free, because plastics again are a big thing, what we store our products in. So right on, and but it's again, we don't get there overnight. I look at where I was 3 years ago, totally inflamed, and unaware of the amount of what that environment, you know, the hamster in the hamster wheel. So we all got to take time to slow down, take a deep breath, find our balance, get outside. It's a beautiful day out there today. Get some fresh air, sunshine. Get your shoes off and ground in that beautiful soil. Those things just kind of set your compass straight and make your day great.
Yeah, absolutely. And it is a journey. All right, Dr. Meyer, how do folks come see you?
Yeah, give us a call at 712-339-6024. We are at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. We do our discovery calls that are complimentary. It's a 15-minute call with me, and we go over briefly kind of your story, your history, and what you're wanting to accomplish, what your goals are, and how we can walk alongside you to help you achieve that coming through our clinic. Come in, stop by if you want a tour as well, just to take a peek through. And it's a family here, and everybody's welcome. It should feel like your living room. So very peaceful, and we'll love to see your smiling face. So we got a great team.
Very good. Dr. Meyer, always a pleasure. Thank you so much, and we'll talk to you again next week.
Yeah, sounds great, Dave. Take care, everybody.
Thank you very much. Dr. Bradley Meyer of the Okoboji Wellness Clinic. Find out more at okobojiwellnessclinic.com.